Stay.
This patient is coming to us from Germany. He has been operated for fistula in 2020 first time. At that time he had developed a abscess in this region, for which they had done the surgery in a hospital near Frankfurt, and they had done the drainage, and following that they understood that this was a fistula, and within a period of 6 months he underwent another surgery for the abscess, and at that time they inserted a satin in this. So this was a satin which was inserted, and since then he is already operated almost 6 times, but recurrently he is having the problem, and finally they have inserted this satin as a permanent, and whenever he faces problem, then he goes to doctor, and sometimes they do the surgery and just cleaning, but they are not removing this, or then but because the satin is there, this is not letting the inside opening, outside opening close. So what happens, whenever the pus collects, it comes out through the side of this. So this is a very good drainage mechanism, especially in a cases where we think that we cannot give a permanent cure to the patient, or where there is a chances that disease will keep on coming again and again, and inside damage is too much. So satin is a very good strategy. This is more of a drainage satin, but patient keeps on suffering, and he cannot live his life like this with this permanent satin inside, and this is uncomfortable also, and on and off it gets blocked. When it gets blocked, he gets pain and discomfort. At that time he goes to the doctor, then they do a surgery, clean it, and again replace it. So if we have to do permanent cure, we have to think of removing this out and recreating whatever the damage the fistula has done, and we have to actually go inside and completely remove that unhealthy tissue which is not letting the internal opening close, and whatever the muscle or tissue damage has already happened, we have to try to recreate that part. So some muscle part portion cannot be recreated, we have to recreate it with the help of the granulation tissue. It gives a good support, and many times with these fibers, when they finally form the normal shape of the canal, and chances of incontinence is there, but negligible. It is very less, 8 to 10% incontinence. Even if it happens, it is better than having a permanent satin in this, because for this he is constantly having issues again and again. For how long you are having this satin?
6 years. 6 years.
For 6 years. For 6 years he is living with this satin, and he's young. At the age of 40, if you think that you will keep on living the rest of your life with the satin, it is very difficult. So our aim is taking out the satin, recreating whatever the damaged tissues has happened inside, and whatever unhealthy tissue is there, that also we have to get, as well as clearing the all fistulous tracts. So the first surgery was done in Frankfurt?
Yeah.
Okay. After that, the next surgery is?
Oh, Frankfurt.
There only. Almost every 6 months?
Yeah, ratio is 6 months. Yeah.
6 surgeries in a period of almost 4 years. He has already undergone 6 surgeries in a period of 4 years, and I know this is a complicated situation. Many times thinking that we will not be able to cure, we try to control the thing. That can be a strategy for some of the patient where the complete cure is not possible, but in this case I believe we can try for a permanent cure for the fistula. Thank you.